everyone, this is Nurse Anna from nursestudy.net, and today we're going to be starting our respiratory disorder series. We're going to be starting with COPD, 25 questions with answers and rationales. Enjoy. And if you would like one of our free audio books with NCLEX questions on ACX or Audible, the links are in the description below. Enjoy the questions.
Question 1. A 72-year-old male with a history of COPD is receiving oxygen via nasal cannula at 4 liters per minute. He becomes increasingly drowsy, with a respiratory rate of 8 breaths per minute and SpO2 of 91%. What is the nurse's priority action? A. Encourage the patient to take deep breaths. B. Increase oxygen flow rate to 6 liters per minute. C. Notify the healthcare provider and prepare to titrate oxygen down. D. Place the patient in a high Fowler's position and continue current oxygen. Correct answer, C. Rationale: COPD patients rely on hypoxic drive to stimulate breathing. Excessive oxygen can blunt this drive, leading to hypoventilation and CO2 retention. The nurse should notify the provider and prepare to decrease oxygen to avoid worsening hypercapnia. Deep breathing, A, is ineffective if the patient is drowsy. Increasing oxygen, B, may worsen the condition. Question 2. A nurse is caring for a patient admitted with an acute COPD exacerbation. Which assessment finding requires immediate intervention? A. Barrel chest and diminished breath sounds bilaterally. B. Pursed lip breathing and use of accessory muscles. C. Sudden confusion and restlessness. D. Productive cough with greenish sputum. Correct answer, C. Rationale: acute changes in mental status such as confusion and restlessness may indicate hypoxia or hypercapnia and require immediate intervention. The other findings are expected in COPD and do not indicate a sudden deterioration. Question 3. A patient with severe COPD is prescribed tiotropium, Spiriva, via a dry powder inhaler. Which statement by the patient indicates the need for further teaching? A. I'll take this medication every day, even when I feel fine. B. I should rinse my mouth after using the inhaler. C. I will not swallow the capsule, but insert it into the inhaler. D. I can use this for quick relief when I feel short of breath. Correct answer, D. Rationale: tiotropium is a long-acting anticholinergic used for maintenance therapy and is not a rescue inhaler. It has a delayed onset of action. Swallowing the capsule, C, is incorrect use, but the patient didn't say that. Rinsing the mouth, B, can help reduce dry mouth. Question 4. A nurse is planning care for a patient with COPD and persistent hypercapnia. Which intervention is most effective in reducing carbon dioxide retention? A. Administering high-flow oxygen to maintain SpO2 greater than 98%. B. Encouraging deep and fast breathing exercises. C. Teaching pursed lip breathing during exhalation. D. Increasing protein intake to support respiratory muscle strength. Correct answer, C. Rationale: pursed lip breathing helps prolong exhalation, preventing air trapping and reducing CO2 levels. High-flow oxygen, A, can worsen hypercapnia in COPD. Fast breathing, B, can lead to fatigue. Protein intake, D, is important but not the most immediate strategy. Question 5. A nurse is caring for a patient with COPD and cor pulmonale. Which finding should the nurse report immediately to the healthcare provider? A. Bilateral pedal edema. B. Elevated jugular venous pressure, JVP. C. Weight gain of 4 pounds in 2 days. D. New onset crackles in the lower lung fields. Correct answer, D. Rationale: crackles are not typical in COPD and may indicate fluid overload or left-sided heart failure, which could complicate cor pulmonale. Edema and JVP are expected findings. Rapid weight gain, C, is also concerning but less urgent than signs of pulmonary congestion. Question 6. A patient with COPD is prescribed methylprednisolone IV during an acute exacerbation. Which lab value should the nurse monitor most closely? A. Potassium level. B. Hemoglobin level. C. Platelet count. D. Calcium level. Correct answer, A. Rationale: corticosteroids like methylprednisolone can cause hypokalemia, especially with concurrent use of beta agonists. Hypokalemia increases the risk of cardiac arrhythmias. The other labs are less likely to be affected immediately. Question 7. A nurse is educating a newly diagnosed COPD patient about energy conservation techniques. Which statement indicates a correct understanding? A. I will take a hot shower in the morning to loosen my mucus. B. I should rest 30 minutes before eating to avoid shortness of breath. C. I should drink large volumes of fluids before bedtime to help thin secretions. D. I will push myself to complete all tasks in the morning when I feel strongest. Correct answer, B. Rationale: resting before meals conserves energy for eating, which is often tiring. Hot showers, A, may worsen vasodilation and fatigue. Large fluids at night, C, may cause nocturia. Overexertion, D, may increase dyspnea and fatigue. Question 8. A nurse is reviewing discharge instructions for a patient with COPD. Which of the following statements requires follow-up? A. I will avoid crowds during cold and flu season. B. I'll use my albuterol inhaler before going for a walk. C. I'll call my provider if I notice increased sputum or coughing. D. I will avoid all physical activity to conserve my energy. Correct answer, D. Rationale: complete inactivity can lead to deconditioning and worsen dyspnea. Patients should engage in regular, paced physical activity. The other statements are correct and promote good disease management. Question 9. A COPD patient is being prepared for discharge. Which assessment finding indicates effective treatment and readiness for discharge? A. PaCO2 60 mm of mercury, respiratory rate 32 breaths per minute. B. Arterial pH 7.29, oxygen saturation 93%. C. Decreased dyspnea with ADLs, clear sputum production. D. SpO2 89% on 3 liters per minute oxygen, audible wheezing. Correct answer, C. Rationale: decreased dyspnea and clear sputum are signs of clinical improvement. PaCO2 of 60, A, and acidosis, B, are abnormal. Persistent wheezing and low SpO2, D, indicate inadequate gas exchange. Question 10. A patient with COPD is being weaned off oxygen after an exacerbation. The nurse notes that the patient becomes anxious and dyspneic when oxygen is decreased from 2 liters per minute to room air. What should the nurse do first? A. Apply oxygen at 2 liters per minute and notify the healthcare provider. B. Administer a dose of prescribed lorazepam for anxiety. C. Encourage slow breathing and monitor for 30 minutes. D. Instruct the patient that oxygen therapy is no longer needed. Correct answer, A. Rationale: reapplying oxygen is the immediate step to address hypoxia and reduce distress. Anxiolytics, B, may mask symptoms or depress respiration. Monitoring, C, is appropriate only after stabilizing the patient. Option D dismisses patient symptoms and is unsafe. Question 11. A patient with a 30-year history of COPD reports increasing shortness of breath and fatigue. The nurse notes clubbing of the fingers and a PaO2 of 58 mm of mercury on arterial blood gas. What is the nurse's best interpretation of these findings? A. This is a normal finding due to the chronic nature of COPD. B. The patient is experiencing metabolic acidosis. C. The patient has developed chronic hypoxemia. D. The fatigue is likely due to medication side effects. Correct answer, C. Rationale: finger clubbing and a low PaO2 indicate chronic hypoxemia, a hallmark of advanced COPD. While these findings may be expected, they are not normal and require continuous oxygen therapy and further evaluation. This is not a metabolic issue, B, and fatigue, D, is nonspecific. Question 12. A nurse is caring for a COPD patient with increased sputum production. The sputum is thick and difficult to expectorate. Which nursing intervention is most appropriate to assist the patient? A. Withhold fluids to prevent pulmonary edema. B. Encourage oral fluid intake up to 3 liters per day. C. Suction the oropharynx every 2 hours around the clock. D. Administer oxygen via non-rebreather mask. Correct answer, B. Rationale: increased fluid intake helps thin secretions, making it easier to expectorate mucus. Withholding fluids, A, is harmful. Routine suctioning, C, is invasive and used only when necessary. A non-rebreather mask, D, delivers high-flow oxygen, which is risky in COPD unless there's severe hypoxia. Question 13. Which dietary instruction is most appropriate for the nurse to include when teaching a COPD patient with dyspnea on exertion? A. Eat 3 large meals per day to minimize fatigue. B. Consume a high-carbohydrate diet to increase energy. C. Have frequent, small meals that are high in protein and calories. D. Limit fluid intake to reduce the work of breathing. Correct answer, C. Rationale: COPD patients need high-calorie, high-protein meals and small, frequent portions to meet energy demands and prevent fatigue during eating. Carbohydrates, B, can increase CO2 production. Limiting fluids, D, is not recommended unless contraindicated. Question 14. A patient with COPD is admitted with respiratory acidosis. Which lab value is most consistent with this diagnosis? A. pH 7.48, PaCO2 30 mm of mercury. B. pH 7.32, PaCO2 55 mm of mercury. C. pH 7.50, PaCO2 50 mm of mercury. D. pH 7.28, PaCO2 35 mm of mercury. Correct answer, B. Rationale: a low pH, less than 7.35, and elevated PaCO2, greater than 45 mm of mercury, indicates respiratory acidosis, which is common in COPD due to CO2 retention. Other values either represent alkalosis or do not correlate with respiratory pathology. Question 15. A COPD patient is prescribed albuterol and ipratropium via nebulizer. What action should the nurse take to ensure proper medication delivery? A. Administer both medications simultaneously in the same nebulizer. B. Administer albuterol, wait 5 minutes, then administer ipratropium. C. Administer ipratropium, wait 5 minutes, then administer albuterol. D. Administer one in the morning and the other in the evening. Correct answer, A. Rationale: albuterol, a beta agonist, and ipratropium, an anticholinergic, are often combined in the same nebulizer treatment. This optimizes bronchodilation. Staggering doses is not standard unless specified. Question 16. A nurse is reviewing lab results for a COPD patient receiving theophylline. The patient reports nausea and insomnia. What is the nurse's priority action? A. Reassure the patient that these are expected side effects. B. Hold the next dose and notify the healthcare provider. C. Instruct the patient to take the medication with food. D. Encourage the patient to increase fluid intake. Correct answer, B. Rationale: nausea and insomnia may indicate theophylline toxicity. The nurse should hold the dose and notify the provider to check serum levels. The therapeutic range is narrow, 5 to 15 micrograms per milliliter, and toxicity can lead to seizures or arrhythmias. Question 17. Which assessment finding indicates a potential complication of long-term corticosteroid therapy in a COPD patient? A. Decreased blood pressure. B. Hyperkalemia. C. Delayed wound healing. D. Polycythemia. Correct answer, C. Rationale: corticosteroids suppress the immune system and can delay wound healing. Other complications include hyperglycemia, osteoporosis, and increased infection risk. Hypertension and hypokalemia are more typical than hypotension or hyperkalemia. Question 18. A patient with advanced COPD tells the nurse, "I'm so tired of being short of breath. I wish this would all end." What is the most appropriate nursing response? A. Let's focus on the positive, at least you're not on a ventilator. B. You sound frustrated. Would you like to talk more about that? C. That's not something you should say, your family needs you. D. You should ask the doctor about antidepressants. Correct answer, B. Rationale. This response uses therapeutic communication by acknowledging the patient's feelings and inviting discussion. It does not minimize or judge the patient's experience. Jumping to pharmacological solutions, D, or using false reassurance, A, C, is inappropriate. Question 19. Which home care instruction should the nurse prioritize for a COPD patient discharged on home oxygen therapy? A. Use petroleum jelly around the nose if it becomes dry. B. Store oxygen tanks near the kitchen for easy access. C. Avoid smoking or open flames near the oxygen equipment. D. Only use the oxygen while sleeping or exercising. Correct answer, C. Rationale. Safety is the priority. Oxygen supports combustion, so avoiding flames or smoking is critical. Petroleum jelly, A, is oil-based and flammable. Water-based lubricants should be used. Storing tanks near heat, B, is unsafe. Oxygen should be used as prescribed, not just situationally, D. Question 20. A nurse is evaluating a COPD patient's response to bronchodilator therapy. Which assessment finding indicates that the treatment was effective? A. Respiratory rate increased from 20 to 28 breaths per minute. B. Patient reports decreased anxiety and improved breathing. C. Presence of wheezing throughout all lung fields. D. Increased production of thick yellow sputum. Correct answer, B. Rationale. Subjective improvement in breathing and anxiety reduction suggests effective bronchodilation. An increased respiratory rate, A, or wheezing, C, indicates unresolved bronchospasm. Yellow sputum, D, may signal infection. Question 21. A COPD patient is admitted with an exacerbation. ABG results show pH 7.28, pH CO2 68 mm of mercury, HCO3 28 milliequivalent per liter, PaO2 55 mm of mercury. What is the most accurate interpretation of these results? A. Acute respiratory acidosis with no compensation. B. Compensated metabolic alkalosis. C. Partially compensated respiratory acidosis. D. Uncompensated metabolic acidosis. Correct answer, C. Rationale. The pH is acidic, PaCO2 is elevated, respiratory acidosis, and HCO3 is also elevated, indicating the kidneys are attempting to compensate. Since pH is not yet normal, it's partially compensated respiratory acidosis. Question 22. A COPD patient receiving 2 liters per minute of oxygen by a nasal cannula suddenly develops a headache, confusion, and flushed skin. What is the nurse's priority action? A. Administer a bronchodilator immediately. B. Increase oxygen to 4 liters per minute. C. Assess for signs of carbon dioxide narcosis. D. Discontinue oxygen therapy immediately. Correct answer, C. Rationale. These are classic signs of CO2 retention, carbon dioxide narcosis, a risk in COPD patients receiving supplemental oxygen. The nurse should assess and notify the provider before adjusting therapy. Increasing oxygen without guidance can worsen the condition. Question 23. Which nursing assessment best reflects a positive response to pursed lip breathing in a patient with COPD? A. Use of accessory muscles while breathing. B. Decreased respiratory rate and increased SpO2. C. Reports of dry mouth and throat irritation. D. Productive cough with yellow sputum. Correct answer, B. Rationale. Pursed lip breathing slows exhalation, improves oxygenation, and reduces air trapping. Decreased respiratory rate and increased SpO2 show effectiveness. Accessory muscle use, A, and sputum production, D, do not reflect success of this specific technique. Question 24. A nurse is reinforcing smoking cessation education for a patient with COPD. Which patient statement demonstrates understanding? A. Once I quit smoking, my lungs will return to normal. B. I should consider nicotine gum or a patch to help quit. C. I will switch to e-cigarettes because they're safer. D. I can still smoke 1 or 2 cigarettes when stressed. Correct answer, B. Rationale: nicotine replacement therapy can aid smoking cessation. The lungs do not return to normal after COPD damage, A, and e-cigarettes, C, and occasional smoking, D, are not safe alternatives and contradict cessation goals. Question 25. Which nursing intervention is most effective in preventing postoperative pulmonary complications in a COPD patient? A. Encourage deep breathing and use of incentive spirometer. B. Restrict fluids to prevent fluid overload. C. Place the patient in a flat, supine position. D. Administer antibiotics prophylactically. Correct answer, A. Rationale: incentive spirometry promotes lung expansion and helps prevent atelectasis and pneumonia postoperatively. Restricting fluids or supine positioning can worsen pulmonary function. Antibiotics are not routinely prophylactic unless ordered.